So, how do we actually diagnose this, or how does a patient present with lymphoma to the doctor or to the hospital? Generally, this, like I said earlier, is a disease of the lymph nodes. So, there will be a swelling somewhere in the body which may be obvious, like if it is in the neck region, or it is in the axilla, or it is in the groin region. And some of the lymph nodes are deep down in the chest and inside the abdomen, which cannot be felt easily from outside. And hence, if there is any swelling which is abnormal, even if it is not painful and it is growing in size, it is good to meet your doctor and find out what is happening. The other thing about these lymph nodes is that it is not only in lymphomas that they are increased in size, they can be increased for a variety of other reasons, including infectious diseases and inflammations. And in India, the most common cause is tuberculosis. So it is not necessary that any swelling in your body is a lymphoma, but if there is a swelling which is increasing in size, it is always better to get a diagnosis made by a person who is experienced in treating and in an institute. What are the other symptoms that the patient may present with lymphoma? Some of them just have low grade fever for a long period of time, which goes unattended, or they start beginning to lose weight, or they start getting abdominal distension. Lymphomas don't only happen in lymph nodes, liver, and spleen, but actually they can happen in any part of the body from the head to the foot. Basically, that means it can happen in the central nervous system, it can happen in the thoracic cage, it can happen in the abdomen, and it can happen as a swelling in any of the bones as well. So, the most important thing about lymphoma is to diagnose it correctly and to stage it correctly, because the entire treatment depends on these two pillars. Diagnosis of lymphoma is done by actually finding out what is inside the lymph node, which is a good pathology. And so, for a good pathology, we need to remove a small piece of the node or the node in totality to understand what lymphoma it is, confirm the diagnosis, and also to subtype whether it is Hodgkin's or whether it is a non Hodgkin's lymphoma, which is low grade or high grade. Uh, Many people ask that if we do a needle test, can we make out whether it is a lymphoma? So one may get a suspicion of lymphoma in a needle test, which is also called FNAC, but we will never be able to subtype the lymphoma on a needle test. And hence, a good excision biopsy or in a large node an incision biopsy is what your doctor will advise you, and that must be done at the earliest rather than delaying it indefinitely. Once the biopsy specimen is with the pathology department, then they do many tests on it. So sometimes, if it is a common lymphoma, we come to the answer very quickly and you may get your report in 4 to 5 days. But often, it is difficult to make out the many subtypes of lymphomas which now exceed more than 50. And so the pathologists have to do some special stainings to understand which subtype it is. And even if it is not clear at that point, they also do some cytogenetic evaluation and today what we call as molecular tests, and hence your report may get a little delayed, but it is extremely important to get a correct subtype diagnosis so that your doctor does the correct treatment and does not start treatment in a hurry and end up with a difficult to treat patient. So, after diagnosis, the next important thing is staging of these patients. And staging is important because it actually helps us understand how long the treatment should be and how intense the treatment should be, or should we not treat these patients at all. Generally, we classify these patients into 4 stages. And the first stage is if it is a very localized disease, only one lymph node organ is involved, then we call it stage 1. If there is more than one lymph node on the same side of the diaphragm, and the diaphragm is kind of a partition between the chest and the abdomen. So, if all the nodes are on one side of the diaphragm, we call it stage 2. If the nodes are on both sides of the diaphragm, that means in the chest and below the chest, then it is termed as stage 3 disease. And if this disease is spread out either in the liver or in the bone marrow or has already gone into the brain, then we call it as a distant spread out disease, which is stage 4 disease. And the treatment and the outcomes are completely different from stage 1 to stage 4, depending on whether it is Hodgkin's lymphoma, whether it is non Hodgkin's lymphoma, the indolent type, which is the low grade type, or it is non-Hodgkin's lymphoma, the aggressive type, which is the high-grade non-Hodgkin's lymphomas.